Hello everyone, we are back with another lecture for the students of forensic nursing on the topic forensic nursing care in case of sexual assault. I am Dr. Jaspinder Pratap Singh, Assistant Professor and Head at Shri Mata Vaishno Devi Institute of Medical Excellence, Katara. So here we proceed with our lecture on forensic nursing care in case of sexual assault. So coming to sexual assault, it leaves physical, psychological, social, economic consequences, which not only endangers the well-being of a survivor, but also have a negative impact on their families. So, as a healthcare provider, we have a duty to give a medical, psychological, as well as the legal service at the hospital and also at the community level. Why don't the uh, victims or the survivors of sexual assault lodge the complaint or are reluctant to lodge the complaint just because of fear of police investigation procedures, maybe due to some threats, maybe shame related to sexual assault, lack of support from their own community, fear that no one will believe them, and more importantly, due to lack of information about negative health consequences. We usually use the survivor and not the victim, because survivor, we think or we believe that they are capable of taking decision despite being victimized, humiliated and traumatized due to assault. Thus the term used is survivor of sexual assault. So coming to the medico legal aspect, the Union Ministry of Health has asked all the hospitals to set up a designated room for forensic as well as the medical examination for the victim of rape. The victim of rape or the sexual assault survivor, she can directly go to the doctor who should examine her after obtaining her consent, and after examination he should inform the concerned police station, and according to section 51 section 2 of BNSS, whenever a female is to be examined under this section, the examination shall be made only by or under the supervision of a female registered practitioner. In adult female survivors, though female doctors are preferred, but still the examination could be done by a male doctor after consent and in the presence of female attendant. But in case of a child victim, as per the Protection of Children from Sexual Offences, which is POXO Act, a female doctor should examine the child, and non-availability of female doctor at that duty time may also lead to delay in examination as well as the evidence collection. Now coming to the examination of a victim, the history taking as well as the examination should be carried out in a complete privacy. The room should have an adequate space, sufficient lighting, a comfortable examination table, and all the equipment those are required for the examination must be present there. The Government of India has launched Sexual Assault Forensic Evidence Kit, commonly called as SAFE kit, which includes all the equipment or the things those are required for the examination. Those are included in this kit. Now coming to the content of the SAFE kit. This may include the forms for documentation, large sheet of papers in which the patient can undress over, paper bags for collection of clothing, sterile cotton swabs, swab guards for biological evidence collection, comb, catchment paper, nail cutter, wooden sticks for fingernail scrapings, small scissors, urine sample collector, tubes, vials for collection of blood samples, syringes, needles for drawing blood, distilled water, disposable gloves, glass slides, envelope or boxes for individual evidence samples, labels, lock for sealing the samples, clean clothing, shower, hygiene items for survivor which can be used by her after the examination. We may need good torch or wood lamp, vaginal speculum, drying rack for wet swabs or clothings, patient gown, cover sheet, blanket, pillow, and a camera for photography, microscope, colposcope, and toluidine 1% blue dye may be required to look for the minor injuries which are not available for the naked eye, urine pregnancy test kit, surgery loops, and other medications. Those can be included in the safe kit. Now, coming to the examination, which is the most important part, the examination should be carried out without any undue delay because minor degree of injury they may fade rapidly and the swelling and the tenderness of the vulva may disappear in few hours. The detection of spermatozoa from the genital tract also diminishes with the time delay. One of the most important clauses that nothing is in this section shall be lawful if examination is done without the consent of the female. Now, coming to the consent, and informed written consent in a prescribed manner should be taken from the survivor or from the legally accepted guardian before the conduction of a medico legal examination. Consent is valid only after the certification from the doctor that person is mentally sound or competent enough to give consent. It should be in their own language, well understandable about the entire procedure, evidence collection from the body, genitals, as well as the treatment. All the queries by the patient or the survivor should be clarified. Now, the survivor aged 12 years and above can give consent for safe and further management. Like in situation where the age is less than 12 years, the physical and mental incapacities, maybe the patient is in intoxicated stage or there are language barriers, one should seek the consent from the parents or the guardians. There are special educators, interpreters, and support person from the child welfare committee. The survivor has the full rights to refuse for the medical legal examination at any point of time. And after that, no examination of sexual offense survivor to be conducted on refusal. And in such cases, the refusal of survivor needs to be documented and informed to the concerned police personnel. Now, these days, even in the courts, they must ask for the informed refusal which has been documented properly in the medico legal register. So these can be the physical examination findings. There can be extragenital injuries present over the eyes, bite marks over the cheeks, lips, the breast, presence of seminal stain, presence of any soiled area, injuries over the hands or anywhere over the any part of the body including the external genitalia, presence of matted hairs over the pubic region can be found. So the examination protocol as well as the brief findings in case of sexual assault cases can be summed up in this table where we have to go for local or the genital examination. The vulva is assessed for any kind of tears, swellings, abrasions or any discharge. We have to look for the laceration of hymen that may occur in the first intercourse. There can be tear at the posterolateral position as well as the edema. The foresheet open often tears during the first intercourse. The bruises on the anterior wall of vagina as well as the posterior wall of vagina along with discharge can be looked upon. The presence of cervix over the external os of the cervix, presence of abrasions that can be documented in injuries. Now coming to the detailed examination of victim, the first and foremost thing is the detailed history which tells about the time of incident, whether she knows anything about the accused, whether she was given any kind of food, drink, or which may have affected her consciousness, whether she was put under any kind of threat, number of alleged assailants, any drug intake, any details of the struggle or the injury sustained. We all have to ask from the patient. Now, other history include type and number of sexual act, use of any condoms or lubricants, use and disposal of sanitary pads, tampons, was there any pain experienced, or whether the ejaculation took place inside the vagina or outside the vagina, whether she have seen any kind of discharge, whether there was any kind of bleeding, whether she called for help, any recent consenting intercourse, if she did, if whether she can be a married female. The detail of events after the alleged assault should also be documented in the form like whether she have changed or washed her clothes, whether she have bathed, douched, defecated or urinated prior to the examination, whether she have washed, brushed or combed her hairs, whether she have taken any kind of drug or alcohol, any kind of treatment taken. So these are the very, very important part of the history. Other is the past history with regard to the sexual experience, menstrual history, any kind of vaginal discharge, any kind of venereal disease, previous pregnancies, any kind of pelvic operation if she have undergone. Those should also be recorded. Now, if the victim is in menstrual period, a second examination should be done after the stoppage of menstruation. The gait of the person must be observed, as there can be pain which can lead to the guarded gait. The victim with walking with the legs apart and slow paces is the form of guarded gait. Now, one should not undress the female, but she should be requested to undress herself. The patient should be standing on a clean sheet of paper, and anything that falls should be preserved. Anything can fall like earth, buttons, hairs, fibers, any kind of gravel, leaves. These help in establishing the scene of crime. These are very helpful as a form of trace evidences for us. The whole of the body must be examined for any kind of marks of violence, especially scratches, bruises, lacerations, any kind of area of tenderness, or any form of physical injury that can result from struggle. So these can be the evidences which can be preserved in case of sexual assault, survivor examination, or by the nursing care which has to be given in the case of sexual assault. Those can be clothes which are worn at the time of incident, any kind of foreign material which is to be collected which falls off during the undressing, the collection sheets, those must also be preserved for evidence. The swabs, any soiled area from the bite marks, from the mouth, pharynx, vagina, anus, buccal swabs, hairs, any kind of loose hairs after combing, we get any pubic hairs, matted pubic hairs, the clippings from the fingernail, the blood is also collected from the female, both for toxicological examination and for DNA examination. The scrapings of any kind of dried stain, which can be blood, which can be of seminal stains, the salivary stains can also be collected. Now, what are the objectives of collecting specimen? These are basically to obtain a confirmation of allegations. Allegations which are the part of history. There we make an attempt to establish a link between the victim as well as the scene and between the victim and the assailant. So, a brief summary of all the specimens or the evidences which are to be collected. Those are the hairs. Hairs, those are retrieved through combing from the pubic hairs, any control sample other than preferably from the head, or loose hair recovered any part of the body, any mated pubic hairs. We can look for the presence of spermatozoa or the lubricants, fingernail scrapings for the collection of foreign DNA, any foreign matter which can be present, the blood both for DNA profiling as well as for the grouping, Blood is also collected for the detection of any toxicological substance like alcohol or any kind of drug. This blood sample must be stored at 4 degrees centigrade so that the cells may not lyse till the handing it over to the police official for deposition into the forensic science laboratory. Now, swabs from any body surface which has been kissed, licked, sucked, or bitten for the detection of saliva. All swabs should be packed without any transport medium and refrigerated. The sodium fluoride is used in the vial, which has to be sent for uh, toxicological or drug screening. Others can be the genital swabs from the introitus, vagina, cervical os, any soiled area of the skin. We have to collect the condoms if they are present, which are used during the intercourse, sanitary towels, tampons worn after the intercourse. Now, swabs should be can be used to collect the vaginal epithelium for the DNA study. Otherwise, we have already taken the blood for the DNA profiling. To collect oral swabs for detection of semen or spermatozoa, oral swabs should be taken from the posterior part of the buccal cavity behind the last molar, where the chances of finding any evidence are highest. It can be taken from any part of the mouth, but at this part, the chances of evidence are the highest. Now, while handing over the samples, a requisition form addressed to the director FSL stating what all samples are being sent and what each sample need to be tested for should be stated, like vaginal swab to be tested for semen, spermatozoa, as well as for the DNA. Now, the marks of violence on the person of the victim and the accused. These are the basic evidences of the sexual assault which can help us in obtaining an opinion. Marks of violence about the genitals, the presence of semen stain, blood stain over the clothes or the body of the victim, and can be over the accused. The presence of seminal fluid inside the vagina, the existence of any venereal diseases like gonorrhea, syphilis in both the assailant as well as the victim. The evidence may vary according to the circumstances. Other is the independent corroboration of victim story may be obtained by an eyewitness. Evidence acquired at the crime scene and from the body of the victim or accused. Now, in the opinion, the medical officer do not mention whether it is rape or not. We need not to comment on it as a rape, but we have to rule out the sexual assault. Now, the documentation is the very important part. Whatever we are doing, taking the history or recording the evidences or preserving and collection of evidences, those all things had to be documented. The registers or maybe the digital record should be adequately maintained, which includes proper numbering of MLC, proper documenting the preliminary details, who has brought the patient, any kind of samples or evidence which are collected. Now, the nursing officer assists or as a complement in the cases of nursing care in case of sexual assault. Thus, the name and signature of the constable or the police officer who collected the report as well as the sample should be mentioned in the record, and the confidentiality should be maintained because data can be utilized for reporting to concerned authority for the administration purpose and research without revealing the identity of survivor. Revealing the identity of the survivor without the permission of the court is a crime. Thus, rape is hard to prove but harder to disapprove. You must keep this thing in mind that collection of the minor evidences or the trace evidences as well as the timely examination of the victim can help us in establishing the sexual assault and can help us in reaching a accurate opinion. Thus, a meticulous examination is required in every case of sexual assault. This sums up for today. Like, subscribe, and do share about this channel for more updates on forensic nursing. Thank you.